Hey, welcome everyone into Pharmcast for the Community. I'm your host, Dr. Tim Brown. We're coming to you from the University of Georgia, Athens, and College of Pharmacy as sponsorship, but we're coming from a brand new studio that we've been kind enough to use today from the medical partnership with a gentleman named Flint Buchanan who's allowed us to be here. So tell me, Daniel, is this a nice setup?
This is pretty sweet.
We do special things for you when you come on board, right? I mean, I get to do a podcast on Zoom, and as soon as I have a student involved, here we are. We've moved to a studio just for you.
I know. That's so kind of y'all.
Well, it might be because this month is kind of special, right?
It is.
I have to tell you guys, we are honored this month because we have Miss America, Camille Schrier, joining us to talk about naloxone and opioid use disorder. Camille, thank you once again for joining us. It is so nice to see you.
It is nice to see you both. Thank you so much for having me. I'm glad to be back on the podcast.
Well, so here's my question. Daniel did a little bit of research. Are you the first Miss America that's going to reign for 2 years in a row?
So technically I'm not. It happened once before back in the 30s, and I really need to look up exactly what year because I really get asked this question all the time. There was a certain time that there wasn't actually a Miss America competition for one reason or another. So if we do the math, I'm the 93rd Miss America, but I was crowned in the 99th year. So there's like 5 or 6 Miss Americas that actually didn't have a competition the next year. So it's happened before for various reasons. I know I'm not the first to do this for 2 years, but I'm also going to be doing it in a kind of modified capacity as I continue to transition back to pharmacy school next year, which is, of course, the goal of this whole job is to earn scholarship money to go and use it. So I want to go back and use it.
So that reminds me, and we were talking about this. So we're coming up on the 100th anniversary of Miss America.
Yes.
And then over the years, it has changed and evolved. Where it started in one place, it's really today much more about scholarship. And matter of fact, when you were crowned, you did a science experiment on stage to highlight your background in science, right?
I did it to highlight my background in science, but also because I can't do anything else that would be entertaining for anyone to watch. So it really
I can't believe that, but okay.
Unless you want me to do a stand-up comedy routine, which is probably would have been my second, option there. It fulfilled a couple different purposes. And I think that one of the benefits of doing that actually was to bring that scholarship and academic component that has actually always been a part of Miss America, or at least for a very long time, to kind of bring that to the forefront because it was kind of covered by other things that distracted from what we really do in our job, because it's more than just that one night on television that you actually watch. It's a whole year long of a service and really a full-time job for not only me, but 50 other women across the country. Yeah,
I get that. And, Daniel and I were talking about the fact that we know that you were in pharmacy school at VCU. And if I'm not mistaken, so far you have a total of around $74,000 in scholarship after being involved with the Miss America pageant. Has anything changed since my knowledge here? I have $74,000 listed.
So $77,675.
Wow.
And for other pharmacy students who are listening, or really anyone in college, I'm also an out-of-state student at Virginia Tech, or I was an out-of-state student at Virginia Tech. My pharmacy school is Virginia Commonwealth University. But I pay out-of-state tuition, although I was Miss Virginia. I think that we should call them and tell them that they should give me in-state tuition. Very expensive. And so looking toward 3 more years of pharmacy school, I have a lot more tuition bills to pay. And so that's actually going to pay for about 2 full years of my pharmacy education. And that is a gift, especially since I've taken 2 years of my education off to do my jobs as Miss Virginia and Miss America. It's one of the biggest benefits from this. And I also get experience. So I kind of joke that it's a paid internship.
I love it. Well, and you've mentioned pharmacy student a couple of times. And as we logged on, I talked about Daniel being a pharmacy student, but I want to make sure I do a formal introduction here. I was so excited that we had you on board. I went to you first for introduction, but I don't want to overlook Daniel. Daniel,
absolutely.
Tell me, so you got to co-host here. You are working with what organization from University of Georgia? Because you're one of our P2s, or in your second year of pharmacy school, right?
Right, that's right. So I'm a P2 at the University of Georgia College of Pharmacy, and I'm the co-chair of an operation called Generation RX, which is kind of a subset of APHA, which is the American Pharmacists Association. And we work to educate the community about the potential dangers of misusing prescription medications, which I think is actually pretty similar to your initiative, right, Camille?
That's exactly what I do, really, throughout my year as Miss America. And I think that a lot of that came from my experience as a pharmacy student, and then finally understanding through some of the student organizations and the experiences I had in pharmacy school, how needed that was and how that can help patient safety in so many different ways. And that, you and I aren't licensed yet. We're still student pharmacists, but we can still make a difference even though we don't have a license yet. And that's something that's really important for both of us to focus on and for other fellow student pharmacists to think about.
So Daniel Rogers, never let it be said that as a faculty member, I am not the best one you've ever met. I got you in a studio to meet Miss America.
You really spoiled me. I'm spoiled.
Well, and I have to tell you, the connection here is exactly what Daniel pointed. The organization Geriatrics has a significant investment in discussing the opioid disorder pandemic that we're seeing across the nation. And you alluded to this, the platform. Camille, what's the name of your platform? Because I know you've been doing a lot of work with medications, but what's the official title?
So it is called Mind Your Meds, Drug Safety and Abuse Prevention from Pediatrics to Geriatrics.
So your initiative, but it's a good one. So your initiative is not just one group or another. You're really going from the little ones all the way to the older folks and talking about medication across the continuum. And that sort of plays into what we know with GenRx, right?
For sure. It's very similar, like we were kind of talking about. It's all about educating the community about what these drugs can do to you. And I think that it's really awesome that pharmacists are kind of in an incredible, space to do this. And I think it's awesome that you get to highlight that in this international spotlight, Camille.
It's so important. And I don't think that I realized really how important it was until I started to do it. And I started to meet people who needed that education. And then also when we think about prescription drug abuse and the opioid epidemic, meeting the families, meeting the people, and going to the communities that are affected by this, it opened my eyes to the issue more. And I'm not an expert on this issue. It's something that's important to me, but I will never say that I know everything about it. And I'm constantly learning about the people who are affected, ways that they're affected. There's a lot of nuances in terms of the substance use disorder and recovery communities versus the pharmacy communities and then the manufacturers and then wanting to be a pharmacist. So there's so many different pieces that intertwine. And I've understood so much more about that. And I think that's also going to make me a much better and more educated pharmacy student and pharmacist eventually, with a lot more empathy for patients when I do get there.
Well, so guys, this month, October, is actually called National Substance Abuse Awareness Month. And I have to be honest, I wish I had better news, but I was reading some articles over the past 2 weeks, and I just pulled an article yesterday that talked about nearly 74,000 overdose deaths between April of 2019 and March of 2020. It's up 68,000 reported from the year before. And many people feel that the pandemic is going to exacerbate this even further because of the alienation, staying home, not going out, people falling back into the categories of increased risk of using drugs. But I think the other thing, and Camille, you brought this up in your initiative, is people think about this as being illicit drugs, but from this statistic, I'm almost positive they looked at like prescription drugs like fentanyl, Oxycontin, Vicodin, all those narcotics that are out there. So this isn't about heroin per se. It's a part of it, but it's not a thing. So your initiative about Mind Your Meds, this whole epidemic plays into that. And I know, Daniel, with GenRx, what were the statistics you were talking about? Because you had some stuff that you were reading as well.
Right. So we had a couple of statistics. The Generation RX website actually talks about kind of the fact that over 5,000 people misuse a prescription painkiller, sedative, or stimulant for the first time every day. And that's a shocking statistic. And as you kind of talked about, I've also seen some statistics online that suspected overdoses have risen about 18% since quarantine started.
That's exactly what I've been listening to as well. And one of the really interesting things, and when we think of it from a pharmacy perspective, one of the interesting reasons why people are overdosing more throughout this time is when, especially when people build up a tolerance and they're regular users of these particular substances, then the pandemic happened and their normal ability to get those medications or substances changed. And maybe they didn't use as much for a while, and then they finally get to use again, and they're using the same amount, and their tolerance has decreased. And so that's been leading to a lot of overdoses because of the change of access because of COVID. And then coupled on to the fact that there's now stress of quarantine, change of routines. People are using for the first time what you were mentioning. People are starting to use again because of, maybe underlying mental health issues. It is a huge problem. And unfortunately, in 2020, I was hoping to see by the end of my time as Miss America that we would have a really positive change, but no one expected to have a pandemic. And unfortunately, we've gone backward. But what a better reason to go and talk about this more.
So in your travels as Miss America, because I know even though we've been sort of sequestered, you've done a lot of virtual and you've reached out. Are you hearing about this problem, not just from us here in Georgia, but all over the country?
Absolutely. And one of the reasons I chose this initiative was because it is so widespread throughout the country, particularly on the East Coast, but still nationwide. And it's something that's getting worse and not better. And it's affecting not only people, but families and communities. And so it's more than just the person who is using a substance or facing substance use disorder. It affects that person's family and their children and then their communities, and it affects their ability to get a job. And it's something that really trickles into all pieces of our society. And it's something that I see every single place that I go. And when I start to talk to people about the fact that this is what I advocate for, I hear stories of their brother or their husband or their teacher or their local pharmacist who had a substance use disorder and lost their pharmacy. I mean, these stories that I hear are constant, and it's very sad because there's a rare occurrence that you meet someone throughout, or at least in my experience, that I meet someone that hasn't been affected by substance use disorder, either directly or indirectly, or with someone that they know. And we need to change that because these lives that are lost from drug overdoses are preventable deaths. We can prevent them, and we can educate people. We can learn how to use naloxone. We can help get these people into treatment. It's not a death sentence, and it shouldn't be. And so we need to make changes in our society and destigmatize it so that people are really able to recover and have happy and healthy lives.
I think that's incredible. And it really shows that your initiative and the work that I'm working on with GenRx is really, as important as ever right now. And I think that, we're kind of talking today about naloxone access. You mentioned naloxone. Can you tell us a little bit about naloxone? I actually read that you're a certified naloxone trainer, right?
Look at you overachieving.
So I will take a little credit for that. I got that while I was in pharmacy school. One of the things from pharmacy school that really stood out to me was taking that naloxone training for trainers. So I learned how to be a trainer for naloxone. So I got trained, and then I know how to train you now. But sitting through that course made me really understand the gravity of the opioid epidemic. Walking into that course, which was really just an extra evening after a day full of pharmacy classes, I didn't really understand what Narcan was. And I was a first-year pharmacy student because we hadn't really touched on that yet. Wasn't something I was familiar with. I'm like, I don't really understand what this whole naloxone Narcan thing is. And then understanding what it did. So it's an opioid overdose reversal medication, how fast it works. And it literally can work within a few minutes, maybe even as short as 1 or 2 minutes, that person can be revived from an overdose. And the fact that it actually counteracts what the drug is doing to that person's brain. And with opioids, we're really worried about depression, respiratory depression, and physical, really the body shutting down and not allowing that person to breathe normally. And that's what causes a lot of the deaths associated with opioid overdose. So that medication can basically allow that person to breathe again. And we've created a lot of these substances as humans with science backgrounds, particularly when we talk about pharmaceuticals. And now we've also created this antidote where we can give a person a second chance. And I say that because a lot of people stigmatize the use of Narcan and Naloxone because it's seen as, reversing this person who made a choice. Well, they chose to take this medication, so why would we help them? And I always talk to people about the fact that if that person, even if they made a bad choice, okay, do they deserve to lose their life over that bad choice? I don't think so. If we want to get that person into long-term recovery, then we have to save their life so then we can get them into a recovery center. And that's one of the important things that goes along with it. But naloxone is really easy to use. It comes in either a nasal spray or an injectable. And you, as any person listening or watching this, can help someone if you learn how to use naloxone and you carry it with you. It's an easy thing, kind of like having, first aid or CPR certifications. You become that first responder for people, and it's an easy thing to learn. And so I'm glad that I can be a trainer and really educate people about naloxone.
So, Camille, as you talk about this, I think for the folks, this is going out to the community. One of the things I want to go back, I'll play faculty for a second. Is that okay?
Absolutely.
So, opioids in general are narcotics, are things like hydrocodone or Vicodin or OxyContin. You even talk about Tylenol number 3s that have codeine in them. Even Ultram or Tramadol kind of works on those same receptors. So what Camille was talking about was, if you take too much of that, your body kind of shuts down, and naloxone comes in and knocks those drugs off and basically reverses the situation. And, I know you're trained and we're all in pharmacy here, but what I'm finding is naloxone should have access to people who aren't necessarily pharmacists or physicians or nurses. It's about my grandma, my husband, my wife, my brother, my sister, the people that live in the orbit of that person that's using those drugs. Because if something happens, that's the person that's going to save their life with a naloxone. And if I'm not mistaken, Georgia is one of the states in which you do not need a prescription to get naloxone. Is that correct? I just moved here a year ago, so I'm still learning. So Daniel, you might know more than me about that.
Right. So in Georgia, we can actually, pharmacists, that is, can actually prescribe naloxone without a prescription from a physician. So as long as you can go into the pharmacy and you can tell them, a legitimate reason why you need naloxone, then you can actually get naloxone right there in the pharmacy rather than going through the physician. And that doesn't necessarily mean that it won't be that it will be covered by insurance and stuff like that.
Right.
You can work through that with the pharmacy, but they can get you the naloxone that you need. And I also want to point out that it's not just people using illegal drugs that maybe need this. That's a great use of naloxone that you pointed out, Camille, that, we can use it for those people and then get them to the long-term treatment that they need. But this is also people like your grandma that you mentioned, Dr. Brown, and people that are using these opioids for reasons that their physician prescribed them for. And, sometimes these drugs are really dangerous and things can go south when you don't really expect it.
Well, and that goes back to what you talked about earlier, Camille. You talked about mind your meds. So, let's sort of put all the drugs that are, we'll call them street drugs, to the side for a second. And let's talk about somebody who actually had these prescribed for them for a reason. They're in the medicine cabinet. People have access to them. This is kind of what your initiative talks about, right? When you say mind your meds, it's about cleaning your medicine cabinet out and being responsible, knowing your medication dosing, knowing how much you should take versus what you are taking. Is that sort of along the same lines? Is that what you had in mind when you chose this? I don't want to put words in your mouth. I'm just trying to sort of.
No, you are 100% right. And, I describe my initiative as having really two arms. One of those arms is kind of what we're talking about with that substance use piece and substance abuse with opioids. And that kind of falls into the abuse prevention piece of what I do, particularly with prescription medications, which is kind of what we were just talking about, that it's not just street drugs that we think of. It's people that are either maybe abusing prescription medications, and opioids fall into that category that kind of transcend the prescription and the street drug piece. But there's a whole other wing of what I do, which is medication safety. And that is the pediatrics to geriatrics piece of what I talk about. So if you're a busy parent and you're administering medication to your child, there are so many potential points of error that you could hurt your child with that medication. And that's one of the great things that pharmacists do. We get the opportunity to educate patients and keep them safe with the medications that we're dispensing to them. But not always does that patient get the opportunity to interact with the pharmacist or know why that's important. And so if I can talk to parents and even just regular students like me about staying safe with medications, that can make a difference in terms of, reducing those medication errors. And in my demographic as a young person, a lot of my friends and peers don't really have a respect for medication in general. There's this culture of misuse. And even just thinking of things like cold medication, I had a friend in college that used to chug NyQuil out of the bottle. And I use that example because if you're not going to use NyQuil responsibly, and you're not going to measure your NyQuil, and you're not going to mind when you're taking it, and you're not going to be cognizant of that medication and respect what it could actually do to your body, then how would I expect you to treat an opioid any differently? So talking about staying safe with these medications is so important. How to store them, how to dispose of them. October, we have National Prescription Drug Take Back Day with the DEA. And so I've been able to collaborate on public service announcements with that, cleaning out your medicine cabinet. And that doesn't only happen when National Prescription Drug Take Back Days are. Most pharmacies have disposal locations for you. And so it's just coming up with those small changes that we can do in our own life to keep us safe, to prevent poisonings of our kids, and also to keep medications out of the wrong hands. They all go hand in hand, and then they can also be one of the ways that we can proactively prevent prescription drug abuse down the line. And so it all ties together, and it's all part of really what pharmacists do. And it's been a great opportunity for me to talk about the pharmacy profession as well, because it is a very misunderstood profession in the community. And we have so much that we can offer, and we're one of the most accessible people to our community members. And so it's a great opportunity that I get to use this job to educate people.
I know you and I were talking about this, and Camille, you actually just led to a conversation that Daniel and I were having, really talking about, like, here on campus. You talked about your peer students. We were talking about students here as well. I was in a fraternity in college, and I'm not necessarily singling out Greek. It could be any student anywhere, but you talked about naloxone. I'd never thought of it before until we had a conversation. But should we be advocating that folks that live on campuses, whether it be a dorm, a fraternity house, a sorority house, that they actually have naloxone in the house for emergencies? What were we talking about, Dan? You actually said that this is something that GenRx has looked into because it protects the student life as well.
That's right. Yeah. So GenRx at UGA actually has a college prevention partnership with the Georgia Prevention Project. And every year we actually host a training event for naloxone with the president of every fraternity and sorority so that people in our community are getting this training. And I think that's great. I mean, there are so many people, and I think that's one setting that needs naloxone, but there's so many other settings as well. I mean, I think there's a lot of people out there that need naloxone. I think really if you know somebody that's on a drug like this, you kind of have to look out for, I think this is a drug that can help you a lot in a situation that's kind of scary. And I think you kind of have to think, if you're on something like this, about, do you need something like this?
And asking about it, I think, Camille, you said this earlier, but let's say I have been given a prescription for Vicodin because I just had surgery, and I put it in my medicine cabinet, and I've been on it now for a few months because the surgery was pretty bad. It's okay for the physician that gave me the Vicodin to also give me naloxone just in case, and then my family members need to know that I have it. Because I'm using the Vicodin as I should be. It's prescribed, it's for the pain that comes with that. So, I don't want to get this into and I think, Dan, you bring up a good point that this isn't just about street drugs or stealing a drug or diverting a drug. This could just be regular everyday use of a narcotic. Now, I'm going to pick on you, if you don't mind, Camille. You talked about being a certified naloxone trainer. Mm-hmm. You talked about different versions of it.
Yeah. Can
you walk us through what one would do if you came across someone who had overdosed, or maybe one of your family members had overdosed?
Absolutely. And I am going to say one thing before I go over this. And this is a funny story that I had when I was talking about naloxone as Miss Virginia. You mentioned that when you have naloxone, it would be important to have a family member to know where it is, maybe how to use it. That is one of the biggest misconceptions about naloxone, is that you cannot use it on yourself. It's not like an EpiPen in the sense, that's what it's compared to often. It's not like an EpiPen in the sense that if you're having an allergic reaction, you can administer your own EpiPen to bring yourself back. This is not something that you can do that with. If you are in an overdose situation, you are unconscious. And so you cannot administer this on yourself, which is a huge misconception. And part of the reason why people who aren't drug users or not actively using a substance, we're the people that should be carrying naloxone, because we're going to be the one who's going to be able to administer it to the person that needs it. So I carry it with me, but I will go over a little bit about what it would really look like. It's not a complex thing to really administer. The first thing that you need to do is check for responsiveness of that person. I mentioned that they're probably going to be unconscious if they're really in an overdose situation. First of all, naloxone only works on opioid overdoses. That's important to note. So you went over a couple of the common prescription opioids like Vicodin, Percocet, Oxycontin, but it's the same realm as something like heroin or fentanyl. And so that is what naloxone will work on. But if someone is overdosing on a different drug or maybe experiencing alcohol poisoning, it's not going to work for that. And so what you have to do is just kind of check that person. If they're having an opioid overdose, they're probably going to be kind of blue, cold, clammy. Maybe their nails will be blue. The breathing will be very slow or stopped. You might have to give rescue breaths to that person. And when you do get your naloxone, oftentimes you'll get a rescue breath kit. So I have some breathing barriers that I carry with my naloxone just for personal protection if I do come across someone that I need to do rescue breaths on. Rescue breaths are important because if that person isn't breathing and you do administer the naloxone, you're not going to be able to get that person to start breathing again and get that oxygen flowing into their body, which is the whole reason what you're trying to do is bring them back and get oxygen flowing again. So you do that. We want to make sure that we figure out what kind of naloxone we have. You mentioned that there's a couple different types.
Oh, yeah. You know what, Camille? We actually brought props. If you want us to hold things up, we can.
Yes, hold up the naloxone that you have. I think that you have the branded Narcan.
Yes, the little nasal spray.
Okay, so you have the nasal spray. And then do you have a pre-filled syringe?
I have a pre-filled syringe over here.
Look at us being prepared for you.
You guys are awesome. So, of course, the nasal spray is probably a little bit easier for most people to use. And that one, you do not prime like you would an allergy spray. And you're going to take it and you're going to put the plunger inside the person's nose and completely eject it into the nose.
So this red thing at the bottom is what you push. And should you tilt the head back a little bit so it hits the outside and it kind of does its thing?
Probably, but if you're in a rush, just make sure it goes up the nose.
Gotcha.
It's pretty forgiving, but absolutely you could be able to tilt their head a little bit if that was easier. So just put it in, and then you're going to want to put that person on their side to allow them to wake back up. And if they do, vomit or if they have any issues going on, you want to make sure that their airway is clear is basically what you're trying to do. And you put them on their side kind of with their hands out and with their legs crossed. I could do it, but I can't do it necessarily on video as I'm sitting here. But it's called the recovery position. You would do the same thing with the injectable, but it would not go in the nose. It would go probably, would that be subcutaneous or intramuscular?
Actually, it's intramuscular. It goes into that, the big old muscle on your leg, the thigh.
Yeah. It depends on what kind. I have one that's sub-Q and intramuscular.
Right,
so
exactly.
That's going to function just like an EpiPen. And so you would put that needle right into the person's, probably their thigh or their buttock. That would be the best place that you'd be able to just get that needle in, dispense all of the medication, and put that person into the recovery position again. It's important thing.
Go ahead. I bet you're going to say this, so I'm going to stop. But what were you going to say?
I was going to say the important thing is that you have to call 911 at this point because you need EMS to be on the way. I'm of the mindset that you administer and then call because you want that person to get, recovering. There are, debates on what order you could do that in. You could call and then administer it. But that either way, you need to make sure that EMS is on the way. I would administer the medication and then call and then let them know that you have administered that medication and how much, because there is a potential that that person could then go back into an overdose, because if they've taken something like a fentanyl or a carfentanil that are really strong opioids, the naloxone wears off quicker than the opioid does.
Got it.
And so eventually that person could go back into respiratory depression. And so I'm always of the mindset of letting the EMS know what you've given them.
So I'm almost positive that when you get the nasal sprays, there's 2 doses in there already. So a lot of times you can redose after about, is it 1 or 2 minutes, Camille, that if they don't wake up, you can hit them again and just do it the other side of the nose?
I would say maybe 1 or 2 minutes, especially if they're not breathing, because you're not going to hurt the person if you give them another dose.
Right.
And also, for a caveat, you're not going to hurt the person if you're wrong and they're not in an opioid overdose. It's never a bad idea to give the second dose, or give it when you're not sure that it's an overdose, which is another reason why you need to call 911. Because if that person is having a heart attack and you're like, oh, it's fine, I'll revive them with this Narcan, and you're wrong, you want to make sure that someone's on the way that's going to be able to really help that person.
It's interesting you bring that up, because if you were in CPR training, anybody out there has been through it before, you know that you scream out, call for help. So you talk about calling 911, which I agree with you. I think you should give the first dose if it's you and only you. Yeah. But if it's 2 or 3 of you guys standing there, have somebody else call while you're doing the thing. And I think the other thing, Dan, you held up the syringe. Everybody goes, oh my gosh, through the leg. How will I ever get their pants off? Forget that. Go straight through the paint, right? Because time is of it. You were really great about talking about oxygen, because the more you can get the oxygen flowing. So we have no time to waste here. This has to go in as quickly as possible. So, and then you talked about rolling them on their side, which I love. And then also EMS coming, and also this wears off. They may need more than 2 doses. So sometimes having extra lying around. I say this to everybody out there because I think Daniel was great about talking about access. But when you talk to your pharmacist, talk about the fact that you'd like, at least 2 of them, and you might need that backup just in case, especially if you know your family member has had this problem in the past. Without pointing fingers, we all know sometimes we have folks that can get into trouble. And if you're that person that's trying to help them, being prepared is really going to save their life. And I think that's important. And you did an amazing job. The trainer should get kudos.
Thank you. It's definitely, once you understand how easy it is, I think it can be less intimidating for people, because, if you're in that situation where you're not a medical person, maybe you have this medication on you and you know that you could help someone, but it's intimidating to say, oh my gosh, am I going to do something right? But to know that especially with the nasal spray, it's a spray. And if you just call and to make sure that that person is, going to have a chance if they are overdosing. And if you're wrong, then you're not going to hurt them, I think is pretty helpful. And it calms me when I'm in those kinds of situations to know that. Thankfully, I haven't had to use my own naloxone yet. And so I actually had to get a new one because mine expired. But I guess that's a good thing to have happen, because I didn't have to use it. But I do carry it with me in case I do come across someone. I don't have anyone in my family who is currently taking opioids, prescribed or non-prescribed, but I'm always of the mindset that you never know when you're going to actually come across someone who's in an overdose situation.
Yeah, I think we've talked about a lot, and we've covered a great deal. And we, once again, just love the fact that you took time to spend with us here at University of Georgia and talking with us. We actually covered a lot of different aspects to the opioid use epidemic and what's going on out there. So Camille, I'm going to ask, do you have anything else? Should I ask, or Daniel?
Go for it.
All right. If you had to give the listeners three pearls to walk away from our time together, just sum it all up, what would you tell them?
Okay. 3. I'm glad I get 3 because I wouldn't be able to do 1. I would say 1 would be respect the power of medications, whether or not they're prescribed or over the counter or even illicit drugs. They are substances, they're chemicals, and they are not always inherently safe. You have to make sure that you're following directions and being careful with them, and always ask if you're confused. You can make a mistake that could be really life-altering if you don't use them properly. So respect medications is number 1. 2, I would say that substance use disorder and addiction is not a moral failing, and that it shouldn't be treated like a problem, and it should be treated like a disease, similar to what diabetes is treated like. Okay, this person has diabetes, it's a chronic disease, and we're going to have to figure out how to manage it. That's the attitude that I'd like really being faced with substance use disorder throughout the medical community, and just really culturally in our country. It's not accepted well. It's important that we kind of bring this down to a human level and understand that it's a brain chemical disease that is not necessarily a choice. Maybe it started with a choice, but it's not necessarily a continuous choice. So that's number 2. Number 3 would be to get trained with naloxone, because you can be that first responder that can save someone's life. Especially if you're already CPR and AED trained, then why not just add another one to it? It's really easy. You can do it in a couple hours, or even just an hour. And I'll also mention, I know in Virginia, we have a lot of naloxone distribution events where you can actually get naloxone for free. So sometimes you had mentioned going to the pharmacy and getting it from your pharmacist. Your insurance might not cover it, so you might have to pay for it. But if you're looking to get it for free, look for a naloxone training and distribution event in your area. They happen often. And so if you can find one of those, you can probably get free naloxone and get trained how to use it on the spot. So definitely take advantage of that, especially right now. And if you know someone in your family who is taking an opioid, or even if you don't, it's not a bad idea to have. You could save someone's life.
Yeah, especially knowing what we just talked about at the beginning of the show, 71,000 overdose between April and March. This is something that affects everyone. I think everybody's got somebody in their world where this could actually be a potential issue, whether it's a legitimate use for a product or someone misusing a product. I think your point about being trained is a great one. There are a lot of people don't have to go through formal training. You know, they could stop by that distribution point. The pharmacist could help. And not to be rude about this, it's you put it in the nose and you press.
Yes,
This is
easy.
Yeah, it's not like we're asking you to do, any kind of weird surgeries or anything. This is pretty straightforward. I do want to say that I appreciate you coming on, Camille, and Daniel, thank you so much for being here. We've hit a pretty heavy topic, and we've done it, I think, in a conversation that people can understand. But I do want to leave us with this thing. I was talking to Daniel about this, and we decided that, well, naloxone's important. If people really do have issues with medications and they're misusing certain products and those kinds of things, and you're a family member or someone that is actually doing this, I'd like you to reach out to an organization called SAMHSA. They have a hotline at 1-800-662-4357. It's 24 hours a day. They have confidential referrals. They have support services for family members. They have support services for others. So this organization is designed really for that go-to, where naloxone certainly can save someone's life. To get back on track, this organization can help you and your family members. So don't hesitate to call them. Once again, their name is SAMHSA, SAMSHA, 1-800-662-4357. Also, for any of your states, if you're listening outside of Georgia or Virginia, feel free to look up naloxone access programs for your state. A number of states have what we call standing orders, so you have access to naloxone at various points depending on which state you're in. Then also, I think as Camille pointed out, look for those areas where maybe somebody can train you in this and talk about it and what to do with it. So Daniel, did we do everything we were meant to do today?
I think it was great. We talked about naloxone and how much it can help. We talked about some different symptoms, what you can expect in an overdose, and how naloxone can help. And we also talked about what a great resource pharmacists are and how easy they are to access. I think it's incredible that you're showing everybody that with your spotlight, Camille.
Thank you so much. It's so important, and really now more than ever, it's important. So thank you guys for spotlighting this too.
Oh, I'm just gonna fan out for just a minute and be like, I think it is so awesome that someone that is in the pharmacy profession is Miss America. I think it highlights not only your background and wanting to help others, but the fact that you're on this pathway to becoming that practitioner. And so we are just thrilled that you took the time to talk with us. And I'm just overwhelmed by just what both you and Daniel have done in your short careers already. I can't wait to be even older than I am now and see what you guys do in the next 10 years. I'm very, very impressed.
Thank you so much. I'm excited to see if I'll get a job in 10 years.
Oh, yeah. You've got a job, I have no doubt in my mind. So does Daniel. I want to remind everybody that next month, we're actually going to do an entire episode dealing with reflux and heartburn and overeating. And I chose that because next month, it's Thanksgiving, guys. So believe it or not, the holidays are upon us. I have Dr. Kohler coming in from Digestive Health from Atlanta. She's going to talk about how to combat heartburn, overeating, and I think the other one that happens sometimes during the holidays, that over drinking process whenever we're around the folks. But I'm looking forward to talking with her. I'm also looking forward to sharing the message that Camille and Daniel brought with us today. You guys are great. And again, I want to say thank you so much, Camille, for coming on. And Daniel, if there's an award for like the best faculty out there, I expect the vote for getting you on.
You'll get my vote.
Thank goodness, I got one vote out of 200. Yeah, I'm good. All right, Camille, thanks again. It was so good seeing you.
Thank you, guys.